Hi, so today I'm going to be giving a subcutaneous injection to my patient. First thing I want to do is check my doctor's orders. My doctor has ordered 5,000 units of heparin, so keeping that in mind, I want to check my report and make sure that my patient does not have any allergies that I know of to heparin. No known allergies, so I'm going to go ahead and drop the medication. So from there, I want to gather my supplies. What I would need for this is a 1 ml syringe, an extra needle. The extra needles for sub-Q injection can be anywhere from 23, 25, or 26 gauge, or they can be 3/8, 5/8, or 1/2 of an inch long. So this one is a 25 gauge needle and it's 5/8 long, 5/8 of an inch long. So then I want to keep in mind the 6 rights: the right patient, the right drug, the right dose, the right route, the right time, and the right documentation when giving medication to my patient. I also want to check my medication 3 times before giving it to my patient. So the first time, I'm going to check the drug when I take it out of the Pyxis. This is heparin. It's 10,000 units in 1 ml. So I'm going to be giving 0.5 mils in my 1 ml syringe. And it's in date, so it's good to go. Alright, and since this does not have a sterile cap on it, I'm going to take a alcohol prep after I have washed my hands and clean off the top of the vial. Alright, do not fan that, do not blow on it to get it to dry faster, just let it air dry. So while that's drying, I'm going to go ahead and take my 1 ml syringe. Before drawing up my medication, I want to put in 0.5 mils of air into my syringe. Then, since my vial has dried, go ahead and insert the air, flip it over, and draw up 0.5 milliliters of heparin. I would have another nurse check this. They would say it was okay. Once they said it was okay, I'd go ahead and take that out. Use a scoop method to recap my needle since I'm changing the needle anyway. Take off the old needle and being very, very careful not to touch the tip of this or my new needle, I'm going to go ahead and put it on there. And while I'm doing that, I'm going to check my medication for the second time. The second time, it is still 0.5 milliliters of heparin. So, from there, I'd go check on my patient, I'd knock on the door, I'd wash my hands, I'd grab my gloves, I'd ask the patient to give me his name and birthday while I'm checking their wristband, and then I'm going to go ahead and explain my procedure to the patient. So I'm going to go ahead and tell the patient that the doctor has ordered 5,000 units of heparin to go into an injection site in either his, which is subcutaneous, either the back of his upper arm, his vastus lateralis, which is the side of your thigh, the top of his buttock, the love handle, or the abdomen. So here I'm going to be giving it to him in the back of his upper arm. So from there, I'm going to go ahead and ask him if he has any drug allergies before I give him the medication. No allergies to heparin. So I'm going to scrub that for 30 seconds using friction. While that is drying on my patient's skin, I want to check my medication for the third and final time. So, this is still 0.5 milliliters of heparin. So, I also want to make sure, while this is still drying before it dries completely, that somebody has done, either me or a designated nurse assistant has performed vitals, all of that fun stuff before I give it to my patient, because my patient has probably had a heart attack or had a cardiac stent put in, or his blood is clotting too fast, so he's getting heparin as a blood thinner. So now that has dried on my patient, with a sub-Q injection, you want to pinch the area that you're wanting to give it in, and you want to use a dart-like motion going into a 45 to a 90 degree angle with a bevel up. So I'm going to warn my patient, 1, 2, 3, stick, dart-like motion, and give my patient the medication slowly. From here, I'd put this into my sharps. I'd apply this. Do not massage the area at all. I'd take off my gloves, wash my hands, and then go document how well the patient took the procedure, where I gave it to him, and then come back and check on my patient for any adverse effects around 15 to 30 minutes after. So that is everything. Thank you.